I'm Nick Thomas-Symonds, the Member of Parliament for Torfaen and the Chair of the Aneurin Bevan Society. Welcome to the latest of my interviews with former leaders of the Labour Party on the occasion of the 70th anniversary of the National Health Service. Today I'm delighted to be joined by Harriet Harman MP, who represents Camberwell and Peckham in the House of Commons and who was the acting leader of the Labour Party, first in 2010 and then in 2015.
Harriet, wonderful to see you, and thank you so much for coming along today. I was going to start really with the creation of the National Health Service and its immediate impact on the health of the population, and particularly its impact on the health of women, because prior to 1948, the patchwork healthcare system that existed was heavily skewed towards men because it was principally based upon those who were wage earners, who in that era tended obviously to be male, and who then were able to access healthcare. And a very good example of things that cost money were, for example, childbirth, where it was £10 to deliver a baby. So do you think that the National Health Service over the years has had that impact on equality?
Well, for the first time, women who hadn't been able to afford to have their babies in hospital could actually go to have their babies in hospital. Women who couldn't afford to take their children to the GP or couldn't afford the medicine for them, they didn't have to worry about that anymore. And those women caring for older relatives, suddenly they found that they could take them for the treatment that they needed. So it meant absolutely everything.
When you came into Parliament, which was in 1982, I believe, Harriet, this was another period of great challenge for the National Health Service, particularly because the Thatcher government of the era was introducing various changes, including the internal market later in the 1980s. How do you reflect now on those battles over healthcare in the 1980s when you came into Parliament?
Well, I think a Tory government is always bad for the health service, and Labour always supports the health service. And I think it comes down to the fundamental principles that are the different principles of each party, because we believe in public services provided for everybody. And there's a strand of the Conservative Party that believes that finance for public service is just a millstone round the taxpayer's neck. We believe that everybody should be able to have equal access, and they really believe that you should be paying for it. So that there's the issue about public finance and there's the issue about collective support, which Labour is very strong on. So it's always the case that when we have a Conservative government, it's bad for the health service. And it's all right for people if they're paying for private healthcare and they've got plenty of money, but for most people, for everybody else, it's a problem. And what we see is a pattern. We see underfunding of the health service, we see squeeze and pressure on health staff, we see waiting lists grow, we see accident and emergency in crisis, we see people in hospital who can't be discharged because what used to be the home helps and Meals on Wheels, which is now called social care, is being cut. And it's the same pattern. And where it ends up with is the Conservatives saying, see, the health service is failing. We need to replace it with something more like a market economy in healthcare. So that is the same pathway we're on today, and that exactly replicates what was happening in the 80s and the 90s until we got back into government, trebled the investment in the health service, and turned things around.
I think, Harry, you were Shadow Health Secretary 1995 to 96, towards the end of the 18 years of Conservative government that began in 1979. So you would have seen the state that the National Health Service was in just before we took power in 1997. How bad was it then?
Well, it was very bad indeed. And I always do pie charts of what my constituents come to see me about in my advised surgery. Yeah. And the biggest part of the pie chart was healthcare. And, you know, I remember one woman who was very typical of so many coming down and sitting down in front of me and saying, you know, speaking very quietly, not wanting to be overheard, I'm waiting for my hip to be replaced. I can't go upstairs to the toilet, so I have to use a bucket downstairs. I can't get to my bedroom, so I have to sleep on the sofa. And then she passed me the letter from King's College Hospital her appointment was in 2 years' time, and she just broke down and wept. And that was absolutely typical. I would have anxious families coming to see me saying that their elderly mother is needing a cataract operation on both eyes, and she was becoming more and more housebound, and they were worried by the time she'd got the operation, she would never be able to go out again because she'd just become housebound. So it was devastatingly affecting people's lives, and it was also a matter of life and death. I remember going to visit the cardiology department in Guy's Hospital, and the consultant showed me his waiting list that was up on the wall, and it was all names and addresses of people in my constituency and around. And he ran his finger down the list, stopped here, and he said, everybody below this will die before I operate on them. Because the waiting list was so long, people died of perfectly treatable things. And so that's why it was such a passionate need for us to get into government to actually put the health service back on its feet again. At that point, the Tories decided what they were going to do is give tax relief for private healthcare. So just as they cut the NHS, they were subsidising with public funds private healthcare. So it was one of the most important things for us to get into government in 1997, and we had one of our 5 pledges was actually cutting hospital waiting lists, cutting the waiting times. But as I say, I see so many reflections now. We've got a Tory government again, the same problems are growing.
And in terms of that increase in spending, and it was a great increase in spending between 1997 and 2010, how did you see that coming through to the front line in that period?
Well, it was a massive increase. There was a whole load of problems that were everyday problems that I was dealing with that stopped being problems. So the waiting list category in my advice surgeries, over the years, it just disappeared. The other problem was GP shortages, is that people would come and see me because they couldn't get a GP, because all the GPs' lists were closed, because they weren't training enough GPs. And that disappeared. And more money was invested in community services and in mental health services. And also the buildings were changed, because I remember sitting in King's A&E, literally there was a bucket catching drips from the roof that was leaking. And the buildings were all degraded and tatty. And I remember going to Sweden and going to a very modern hospital and saying to one of the people who was showing me around there, is this private? And they said, no, we don't have private in Sweden, but a modern building, we just didn't have those anymore in the NHS. So there was a massive capital programme rebuilding all the GP centres and rebuilding hospitals. So there was a whole generation of new hospitals and GP centres. So it looked different. The staff were massively increased. The waiting lists were cut.
You've spoken about the increase in staff, which is obviously very important, and the staff have been the bedrock of the National Health Service since its creation. But I know you represent a very diverse constituency in London, and it's also fair to say, isn't it, that workers who've come from abroad to work in our National Health Service really have had a profound impact on it as well?
Well, they've not only been people working in cleaning and catering, but they've also provided some of the highest levels research professionals, some of the most skilled surgeons. So actually, when sometimes the Conservatives say we want a national health service, not an international health service, actually the quality of treatment has benefited from the fact that our NHS has been able to draw in some of the most brilliant doctors, surgeons, people right at the forefront. I was going to say the cutting edge, sometimes they are, but right at the forefront of advancing medical treatment. So actually involving people from all around the world. And I always say when people talk about immigration undermining the NHS, there are more people you're more likely to wake up and find a nurse from abroad by your bedside than actually find another patient from abroad in the next bed. actually you've got more people working in the NHS from abroad who come to this country than are actually using the health services.
The National Health Service has also, I suggest, taken on a real position in our national consciousness. And the one event that perhaps symbolised that was the 2012 London Olympics, and that famous opening ceremony by Danny Boyle, that had the health service and our National Health Service as one of the centrepieces of it. What are your reflections on what the National Health Service means to the British people?
Well, I think it's incredibly important, and to me it exemplifies the overlap between fundamental British values and Labour values, because this is about actually treating people according to their need, not like in so many examples in the United States, for example, whereby people have to pay, and if they can't pay, they can't get the treatment they need. So that sense that we've all got a duty to each other and we should all collectively pay in, and then it's there for us whenever we need it. I think it's the big overlap between Labour values and British values.
The issue, though, that we are starting to face is that there are now very few people alive who can remember what it was like prior to the National Health Service being created in 1948. Do you think then that the 70th anniversary is an opportunity to again make that case for the importance of healthcare free at the point of delivery?
Absolutely. And it's a time to reflect on what actually happens, not only if you don't have the NHS, but if you let the NHS be run down. And those principles which were there at the foundation of the NHS are as important today as they ever were. And it's not just about not having the NHS, it's not supporting the NHS, which puts those principles that we all support at risk.
Whilst we speak about those principles and their history and people's attachment to them for the past 70 years, do you think that there will still be a National Health Service in 70 further years' time?
I think one of the historic responsibilities of the Labour Party is to get into government so that we can protect but also to modernise the NHS. So the future of the NHS depends on Labour.
Harriet Harman, thank you.